watching the Jennylyn Show, and I'm Jennylyn, Gleave, your host. And today, we are Dr. Stuart Melnick's office in Los Gatos, California. We are at the Los Gatos Laser Center, and we're doing this segment for those of you who are unhappy with different parts of your body. Things you want reduced, things you want enhanced. This is the place for you. And so I'm going to start off with Glory, who's the magician here. Hi, Glory.
Hi, pleased to meet you.
Thank you so much for allowing the Jennylyn Show to come in here and share with my viewers the ways they can change the parts of themselves that they don't like. There's so many people who want to add, reduce, enhance. Tell us how you play a part in all of this.
Well, I'm officially a face mapper for the doctor. Dr. Melnick actually does all the beautiful work. And I get to see the patient and go over their concerns, like my face is dropping, I'd like my face to look more lifted, or this line bothers me. How do we take care of it? Well, I'm the one that plays the role in how do we fix it? Well, we don't just fill in a line, we lift the face. We go ahead and put the fillers in the areas that are going to make the patient look younger and fresh, not done, like nothing got done.
Awesome.
Just better.
So this is non-surgical we're talking about. So tell us how you do this.
We use a permanent filler called Artefill, and it lasts 10 to 15 years. And the key is to place it in the right areas where it's going to lift the face and make the face just look refreshed.
That is great. Is this something new?
It's been in Europe 30 years. Of course, we always take longer to get it in the United
usual.
States. It's been about 9 years here in the United States. And Dr. Melnick has been using it for about 5 years. And he's a master injector. You have to be really, really good to work with permanent fillers. And he is.
Well, I chose this clinic because I heard he is the magician.
He is.
That when he injects, he doesn't cause any pain. And he puts it in the places where it needs to go, so you don't look like you've done something. And we've seen so many people, especially in Hollywood, who've had enhancements, and it's so obvious.
Yes. So the key is to do the work, turn the clock back with no telltale signs.
Okay, so the Artefill.
Yes.
How often do you inject it? How long does it last? Tell us more about it.
Artefill is made of PMMA molecules suspended in collagen, and every syringe is a 0.8. Starts lifting the minute it's injected, or it starts correcting the minute it's injected. You don't have to wait to look good. You look good immediately. Now the beauty about this product that it keeps getting better with time. So say you look good, you got injected today, a year later you even look more fabulous.
That is so awesome. So how does it compare to other products? I've heard, I know because I ran a cosmetic clinic at one time, that they have other products like Restylane and Radius. How does this compare to those products?
Well, Restylane, Juvederm, Radius, Sculptra, they're all very good products. The problem is they don't last long enough. And so you get a group of patients that are suffering from what's called filler fatigue. They don't want to keep refilling.
Right.
Every 3 months or every 6 months. With Artefill, you correct an area, you're done. And then say you will come back a few years later and you notice that you could use a little bit more enhancing somewhere else or a little more lifting. You don't have to start from the beginning.
Because of my knowledge of this industry, I know that our collagen slows down when we get to a certain age.
Yes.
And that causes the drooping, and we lose our glow.
Yes.
I read somewhere that Artefill works with your collagen. Tell us about this.
Yes. Well, first of all, let me backtrack a little bit. We lose a teaspoon of bone, muscle, and fat a year starting at the age of 25. So there's a lot of collagen that needs to be made up for the loss of bone, muscle, and fat. So the beauty about Artefill, it stimulates your own collagen production. The PMMA molecules are continually stimulating your own collagen. That's why you look naturally good.
That is great.
Now for how long? 10 to 15 years.
What will determine the lifespan of the product?
I think also the way you live your life. I mean, if you smoke a lot, drink a lot, and you compromise your health, your ability to produce collagen is not as good as maybe someone that lives a healthy life. But that's not a problem because the product's going to keep working regardless.
So is this the only product that you work with, or do you work with the other products?
Work the other products, but it seems like anybody over the age of 40, they just want permanent. They don't want to be wasting their time with temporary injections that are just leaving them empty. Because here's the other problem. Every time you do temporary fillers, you're inflating and deflating the same area over and over again, like a deflated balloon.
Okay.
With Artefill, you're filling it once. You're done.
So if you're someone who's using Artefill around your eyes, do you still need Botox?
Yes, because Botox does one thing, Artefill does another. Botox reduces a muscle activity where Artefill corrects a volume deficiency. So you need both.
Okay, so if someone comes into you and they're unhappy with all of this and stuffed around here, what are some of the areas that you can put this product?
Well, all those areas that you mentioned, but we always start at the top. Lifting starts at the top. The telltale signs of a person that is older and it's not 35 anymore is that they have a recessed area called the temple region, but we call it the peanut head. And it's really indented. That means
like mine.
No, you look amazing.
Thank you.
So that area is the culprit for the face to be lifted. So if that area is recessed, you could pretty much tell the face is dropped forward because there's no support back here. So that would be one of the first areas we fill, is the temple area, to start lifting the face up and providing support.
How often do they have to come in for you to administer these treatments? Or can you just look at them today and say, you'll need 2 syringes and send home a happy patient?
It all depends on their budget and their social calendar. Say, for instance, we can do as much as a patient can do in one sitting. We've done up to 18 syringes in one sitting, and the patient looks amazing, leaves, and they're happy. But say the budget allows only 3 or 4. They're not wasting any of their money, so it doesn't matter. They can come back. If their total plan is 18 syringes, they could do little at a time. If their total plan is 5 syringes, it doesn't matter. They can just do whatever their budget allows because it's not going anywhere.
18 syringes? You've actually had someone?
Yes, and I'll show you some examples of 18 syringes.
Oh my goodness, I cannot wait to see it.
Yeah, it looks totally transformed, beautiful people, and they just actually look refreshed. That's about all.
So a patient comes in here and they say, oh, I'm unhappy with my face, I don't like how this is looking, this needs coming up like mine.
Yes.
Or this needs this, or, you know, and so you take a look at their face, and then what happens? You look at their face, and then...
And then we start marking the areas that need improvement, that we can help the patient with. Some things are textural, like the patient says, I have 20 little lines everywhere. Well, that wouldn't be an Artefill issue. That would be a laser issue. Or the movement would not be an Artefill issue, would be a Botox or Dysport or Xeomin issue. So we start by mapping the face and looking at the areas that only need improvement. We don't need to do the whole face, just the key areas that hold the face up.
So Glory, tell me, beside Dysport, tell us about Dysport and some of the other products.
Well, Dysport, I think Dr. Melnick says is best, is another neurotoxin like Botox, Dysport, Xeomin. We call it Coke or Pepsi. They all do the same job. But some patients do better with one or the other. Depends on their tolerability. Some patients can tolerate Botox better than Xeomin, and vice versa. Some tend to take effect quicker. Xeomin to me is quicker acting, where Botox takes good 14 days, 10 to 14 days.
Got you. So it's just like Botox, but it just depends on...
Just another name brand.
And Restylane and Radius, do you guys administer those products?
Absolutely, and they're wonderful products. Like I said, the only problem has been that they don't last long enough. And with Artefill, patients are so happy. We have happy patients.
I could tell. I see them coming and going. Maybe
happy.
I can be one day soon. So we are joined by this very handsome young man here. And this is Dr. Stuart Melnick. Dr. Melnick, thank you so much for being a part of this.
Good. Thank you very much for coming.
Sure. I can't wait to share with my friends how they can all become the beautiful or more beautiful people than they already are.
Well, Glory Love was my face mapper. I think has summarized things very, very well. I could further add that the reason why Artifil has become so popular is that patients do not want to be operated on with facelifts
That's right.
anymore because of the pain, the downtime, and other medical issues involved. Now, Artifil will last as long, in my opinion, as a surgical facelift. So it's a great answer to surgery.
So you and Gloria are a partner.
Yeah, she maps the face. She has a wonderful eye for where the volume loss has taken place. Then we map the face out, and then I inject the Artifil. We use some local anesthesia, and also Artifil has a local anesthetic agent in it, so it's not as painful as having surgery.
Uh-huh. So how long is the downtime when someone, after someone has had this administered? Is the face swollen? Is it red? Is it turned black and blue? What are some of the side effects?
Well, some patients are what we call swellers, and so we use special drugs or agents to reduce swelling. Other patients don't swell at all, and it's very dependent on what area of the face we actually do.
Okay.
And if I may add, if they're not swellers, they're usually bruisers.
Okay.
So you get one or the other.
Okay.
Now, the one thing I have to say about this product, it swells less than the hyaluronics, which is the Restylane and Radius and all those. And not only does it swell less, you bruise less with it because it's not acidic.
Got
So
you.
you will have the trauma of the needle to contend with, and that also always is a histamine response, and your body tends to bring a little fluid in that area. But in a couple of days, that's pretty much resolved.
And there's no evidence when you've done this that you have.
No.
Nobody can look at you and go,
That's why Dr. Melnick is good.
Well,
what happened to your face?
Lori makes a good point because the hyaluronic acids, when we inject them, stimulate water entering the area. So you get a lot of swelling and filling. So patients may look good for a couple of days, then the water leaves, and it's not as full as it was. That does not occur when we use
Kind
Artifil.
of like a false positive. So they think they're filled and they look amazing,
Right.
but 2 weeks later, when that fluid comes down, they're going, "What happened?"
Uh-huh.
With Artifil, it's you see what you get. It's right there and then.
Does
It's
the product
correction.
move around? Because I know when I worked in this industry, we had situations where we injected patients and the product wound up somewhere else.
In this case, it does not.
It does not,
You
no.
would have to be, the product would have to be smaller than a human cell to be able to be absorbed and moved to other parts of the body. It's not. It's larger. It stays put, it behaves. So wherever doctor says it's going, it's going to stay
And the
there.
other thing with Artifil, as Glory said, if you may need 10 syringes or 18 syringes and you only do 5, if you come back in several weeks, when we add more, you haven't lost the first injections. We're only adding to them.
Uh-huh.
Whereas with the hyaluronic acids, you've actually lost them by the time
Right.
you come back for more.
Right, exactly.
And patients get needle phobia. They're not happy with coming back every 6 or 8 months and being repoked with needles. This way, with Artifil, you do it, and it may last for years and years, and you're done with it.
Cost-wise,
Amazing.
and cost-wise for a patient, it's a great investment because they don't have to keep repeating the same injections.
Right. This is great. So on average, how many patients come here for Artifil versus the other products?
I'm going to say 90% is
Yeah.
permanent filler.
Wow.
I gotta say, it's the injector. He is fantastic at what he does. Our results are beautiful, and the patients are happy. Most of all, that's what we want to see.
Well, our feedback has been so good that the company has then selected me to be a national trainer for Artifil.
Yes.
So other physicians come to our office now to be trained. Last week we had a young doctor here, and we did 4 patients and helped to train her on the use of Artifil. They don't do any injecting, they just observe. I do the injecting with Glory.
Have you always been in this industry? Is this your specialty, doctor?
No, I'm a former anesthesiologist. That's why I'm pretty good with needles.
I was gonna
In pain.
And that's why I don't like, I'm very anti-pain. It was part of my heritage and training.
Yes.
I try to make the patients as comfortable as possible. We have had patients who have come here from other offices for procedures like lip enhancement, and said, "Doctor, it was so painful. I haven't done it in 4 or 5 years." But we do nerve blocks and make areas numb
Absolutely.
so that the patient's very comfortable. And also, if you're creating a face, I don't see how you can work if the patient's jumping around in pain. So we like to keep everybody comfortable.
Got it. So what are some of the side effects that you have seen from using this product?
I've seen.
Because that's always a big concern.
Absolutely,
Of people.
and I've seen really bad results, but from someone that doesn't know how to inject the product. That's why I can't say enough. You have to go to a good injector. You have to go to an experienced injector. It has to be put at the right depth, at the right angle, and the right amounts. And this is what we do here at this office.
So my friends, what they're saying to you is, if you're going to do this, you need to find Dr. Melnick, because it's something, once you've put it in your face, how difficult is it to remove it?
Well, in our case, we've never had to remove anything because it's put right the first time. But if there's any inflammation, there are counteracting steroids that we can use if there was some inflammation associated.
And one quick question,
yes.
and I don't want to forget to ask you this question, because this is something people will want to know. Do you do a spot test beforehand so a patient can know if this product is compatible with their bodies?
Absolutely. We do a skin test, and we have the patient wait 24 hours.
Okay.
And it's kind of like a TB test, just a little tiny dot under the skin. And if it's red, itchy, swollen, well, they're probably not a good candidate for this product.
Okay.
But for most time, we don't see any allergic reactions for the most part, I should say.
The reason why we don't have to take it out, remove it, because as Glory said, we usually begin to fill high up on the face very carefully. And then we have them return and see what's left. Because many times the symptoms of aging in the lower part of the face are really due to loss of volume in the upper part.
Exactly.
So once we've corrected that, you don't need much correction here. So we don't like to start on the lower part of the face.
Okay. And I know when I was working in this industry, which was about 10 years ago, doctors were afraid to put Botox and products like that around the mouth area. Is that still true?
No, we actually Botox the entire face. Again, it's a question of knowing the different nerves and the muscle actions and where to put products.
So if a person is unhappy with something on their face and they can't afford to use the Artefill, then the Botox would be an alternative product, except in the end it costs you more.
Well, the thing is that Botox, a lot of times we're asking Botox to do so much. Like, I want my brow lifted, I want this done. It's just a little Botox. It's a little muscle, what do you call it, doctor? It's just going to reduce that muscle activity, and you're asking it to do so much. Our patients would rather do one Artefill than 20 temporary fillers.
Well, long term, it's most cost effective,
because you can even lift the eye area.
I can use the Botox to do a brow lift, as we call it. But we can use Artefill to do a brow lift that's almost like having eyelid surgery.
And keep it there.
And keep it there.
Okay, well, I thank you so much, Gloria. I'm going to let you go, and hopefully that, you've really informed people who weren't sure about this product, and that they will be coming in to
Thank you
fix
for
what
coming.
they don't like.
Thank you very much.
Thank you. And Sharon, who is one of the technicians that works this machine, is going to tell us about it. Sharon, thank you.
Thank you.
We're excited to find out what this is and what it does.
Okay, this is called the Reaction. It's a radio frequency laser. That's the company that makes it is Viora. And the reason it's so much better than some of the other lasers that do cellulite and tighten the face and neck, thighs, stomach, backside for cellulite or just tightening, smoothing, is because it has a suction. So it's going to suction your body up into the machine and get deeper penetration so that the fibrils of the collagen are smoothed and increased and tightened. So it works really well on faces and on the body. A lot of people come in to get their neck tightened and their face as well. We do all up and through here, down their neck, and it gives you a lift as well. And then with the Artefill, it creates a beautiful result. A lot of people come in for tummies that are pretty stretched when you have a baby, or just cellulite on the backs of the thighs for swimming suits, and it smooths it all out. It takes about 5 treatments to get a good result, and then we usually suggest they come back for a touch-up every 6 months or so.
Thank you. Sharon, what is this laser called?
This is the Alma laser, and it's a soprano XL, and what it does is it permanently reduces the hair on your body. So using a diode laser. It's really, these standalone lasers are really the best lasers for getting rid of the hair permanently. So if you want nice hairless legs for summer with your bathing suit, or arms, bikini, backs, beards, even some people take their beard off, this is the laser for you, because it really does work well. You need about 6 treatments, because the hair grows in cycles, so you want to get the hair in the growing cycle, the anagen cycle. It's a great laser. Photofacial laser.
Is that the same as the IPL?
Yes.
Okay.
So it's a Alma laser, and it's called a Harmony platform. So it does 4 or 5 different lasers. One is the intense pulse light laser. We call it the photofacial, FOTO, but that's really what it is, intense pulse light laser. And we can get rid of the brown spots on your face, arms, body, wherever, or we can get rid of the red capillaries. That's why we have many different heads. Different heads for different things. We also have a head for pixel, which is resurfacing using tiny little holes in your skin, and that rejuvenates your collagen, and the acne scars will go away, or just the larger pores for people that just want to look younger and their skin look more amazing. Our Ashley had it. She loved it. She's our front desk person, and I've had it. You're a little red for a couple of days, and then you peel for 3-4 days. But, you know, come in, Ashley. Ashley looks amazing.
And here's beautiful Ashley. Ashley, how do you like your intense pulse light treatment?
I had the Pixel, and it was amazing. It was really good.
How many treatments did you have?
Just one.
And it fixed the problem. Awesome. Thank you for allowing us to see your results. Thank you, Ashley.
And, you know, we usually do a series for acne scarring. Ashley didn't have acne scarring. She just wanted her pores to be smaller. She may have another one. We do it about once a month. And, you know, you have to be a little careful during the, you know, a week with your face, but then after it peels and it looks amazing. So those are the lasers we have in here. We use a chiller, Zimmer cooler, to chill when we do the hair removal. We use numbing cream. So everything is we try not to cause any pain. We have really excellent RNs that do the lasers. Dr. Melnick as well does the photofacials, IPLs. And the nurses are very careful. They're very good with their patients, and the patients really love them.
You have to buy a package usually of 5, right?
We sell it as a buy 5, get 1 free, because you do need 6 treatments to make a difference. If you can buy each one individually, but the problem is if you don't see the result until about 4 treatments, because the hair goes away in patches, like a moth would be eating away the hair. So people will be disappointed unless they did the whole series.
And so if you are someone with rosacea, which one of these machines can help? I have a few friends who have problems with rosacea.
Yeah. The IPL is also used for the rosacea. It just uses a different head because it looks for the color, the red color, and then it coagulates the little spider vessels that are on your face, and that's what gets rid of the rosacea. We also have a YAG laser as well. That is for, like, if you have little capillaries around your nose, or you have some little hemangiomas on your body. We touch those, they turn black, and they take about 2 weeks to absorb into your body. And then, so we have all, and then we have a scar. We can use a pixel for scars, or stretch marks work pretty well using a couple of different lasers. We have a lot of chemical peels that we do that if you're not into the lasers that can get the same results, we sell medical grade products. Obagi is an excellent product for helping with pigment problems. Elure, same pigment problems. And then Skin Medica. Skin Medica is a wonderful product that has stem cells that help to rejuvenate, and Regenica is also a stem cell product. So everything we do here is to give you great results.
Thank you so very much. It's such a privilege to come here with my camera guy, Brian, and to share with my friends and my viewers the many ways they can enhance those parts of themselves that they're not happy with. So thank you so much, Los Gatos Laser
and
Cosmetic Center, for allowing us to invade your space this morning and share the many ways that people can change what they don't like on themselves. And don't be afraid to make the changes, because like they said, you can look better without having to undergo anesthesiology, surgical procedures to change those things about yourself. So thank you and have a great day.
Thank you.
Bye-bye.